So my assistant and I wanted to answer a very important question that someone asked me on Instagram. And I wanted to do a post because we see this actually very often in our practice. And it's just what is normal vaginal flora? How do I prevent yeast infections if I get them quite frequently? So the answer to that is that the normal vaginal flora, so our vagina contains bacteria. You're not going to be able to bypass that. In fact, the bacteria, it's what keeps the normal pH balance in our vagina, and it's mostly dominated by lactobacillus. So the vagina typically is a lot more acidic. The pH should be around 4. When that pH is disrupted, meaning that there's overgrowth of other different types of bacteria like bacterial vaginosis. Sometimes there's overgrowth of candida, which is yeast. Then that's when you start having symptoms. So bacterial vaginosis is mostly dominated by a really bad odor. So if you have like a fishy smell, I hate to say that, but in general, that indicates that you have bacterial vaginosis. And yeast doesn't really smell, but it itches like crazy, and you'll get this like thick, clumpy discharge. It's super uncomfortable. You'll know that you have a yeast infection. And just to let you guys know, not all vaginal discharge is infective. In fact, most vaginal discharge is very normal and it changes with your cycle. So sometimes it'll be clear. Sometimes you'll be a little bit more dry. Usually that's after your period. Around the time of ovulation, it'll be almost like it looks almost like an egg white or mucusy. It can be very stringy. If you hold it like between your fingers, you can actually see this clear, stringy discharge, and that tells you that it's high ovulation. Think about sperm swimming through that. So usually if you're super dry, sperm can't swim through it, so it can't reach the egg. But if you have frequent bacterial infections or yeast infections, typically it could indicate that you have some other underlying problem. Number one, it could indicate a very poor diet. That's usually the number one reason why people get frequent yeast infections. So if you have a diet that's very high in processed foods or sugars, especially sugar, think of yeast loving sugar. So diabetics, one of the ways that we can diagnose diabetes is actually women who come in with frequent yeast infections. And so typically if a patient comes in with frequent yeast infections, I do like to check them for diabetes to make sure that they don't have that condition. Other things that cause frequent yeast infections are, hygiene. So if you are out swimming and you leave your wet bathing suit on for a long time, that can disrupt the natural flora and sort of create an environment, a nice warm environment where yeast loves to grow, and so you can get a yeast infection that way. Going to the gym and not, washing right away, taking off your wet clothes. So you got to make sure that you do that. Drinking lots of water, so switching from like sweetened drinks to just drinking a ton of water all the time can help prevent. And also having a probiotic daily. Sometimes they do make vaginal suppositories that you can put in probiotics that will help restore your flora. For bacterial vaginosis, that's a little bit of a tougher one because oftentimes bacterial vaginosis can be caused by having a partner who is uncircumcised. So if you find that you're getting frequent BV infections, you should look at your partner and make sure that your partner is circumcised. If they're not, oftentimes the BV can hang out in the foreskin, and then it can just keep infecting you. BV forms this biofilm on the vaginal wall, which sometimes makes it very difficult for antibiotics to penetrate through. So a lot of times women suffer from frequent BV infections just because they're not fully cleared. there are probiotic suppositories that you can put in there. There's boric acid suppositories to keep the pH at around a level of 4. So these are all things that you can do to help. Boric acid suppositories are actually now sold online. I personally like the compounded formulas, but you can get it online. Just please, please, please don't take it orally. These are meant for vaginal insertion, and typically we recommend using them once a week. Diflucan is really good. It's an oral medication that you would take, but that does need to be prescribed by a doctor. You can also use over-the-counter Monistat. I don't recommend the 1-day or the 3-day treatment because those never work. I almost feel like it's a gimmick, because obviously most women will want to do it 1 or 2, maybe max 3 days. They don't like doing the 7-day treatment, but personally I have found that most patients will fail the 1 to 3 day treatment, and so I just tell patients to do the 7-day. For bacterial vaginosis is a little bit more tricky. That one you can either use Metrogel, which is a gel that you place vaginally for 5 days, or you can do metronidazole, which is an oral medication or flagyl that you take for 7 days. Both of those, you should not be taking alcohol with it. They are metabolized by the liver, and so it increases an enzyme that will make you very, very sick if you are drinking alcohol. Okay, sometimes if you get frequent BV infections, you may want to use a condom, and you should be using condoms anyway, unless you're with the love of your life who you trust will not give you any sort of infections. But sometimes strict condom use also helps if you get frequent infections. Okay, I hope that helped. Mona says hello. Have a great day.